Hi everyone, my name is Melanie Grant, and this is CNM Glass. Today we're focusing on our class 2030 for our second part of Evaluation and Management Coding, E&Ms, where we're going to focus on exams and medical decision making. There's going to be two videos this week, one for each of these main focuses, and this one is for exams. Let's take a look now at the differences between the 1995 and 1997 guidelines, as well as how we use those. We'll get started. So, just as it sounds, 1995 versus 1997. These are the two sets of guidelines that are produced by CMS that provide us with guidance on how we're expected to code for evaluation and management services. And specifically, the only differences currently are the exams. Previously, until a couple of years ago, the exam as well as some of your HPI element details were the differences between the two, but only recently CMS decided to include chronic conditions in both 95 and 97 guidelines. For that reason, the biggest difference you need to be aware of between these two is the exam, and you should be using your Novitas scorecard as well as the 1997 element details when you're looking at these. You should combine them to look at them together. That being said, if you look at last week's module, I put together a cheat sheet on the 1997 guidelines, and I highly recommend you have that up both while watching this video as well as anytime you're doing some of your work. Now I'll tell you, one of the things I like to do as a coder is I take those scorecards and I take the exam elements and I stick it into one of those plastic sheets. I do this because I can then take a highlighter anytime on the field or out, and in fact in some of your exam sittings as well, if you're with the AAPC, they allow you to take in, if they allow you to take in a scorecard. You can take that, you can highlight certain areas, and then just use a wipey such as a Lysol wipe to clean it. It allows you to use that scorecard multiple times in a printed version as opposed to just on the computer or going through tons of paper. So we don't want to take all of the treats, but if you have the option, pick up a couple of those little see-through folders that you might put in a binder and put those scorecards in there because it will help you. That being said, let's get started. Okay, so first we look at the 1995 guidelines. I like to pull up my Novitas scorecard for this because it has all the details on here. So that should look a little familiar to you in the camera. I know it's kind of backwards, but you should have that pulled up from some of your previous resources. Now here, I wanted to talk to you about the differences between the different levels of the 95 exam. The first thing is that it is focused by body area and organ system, not elements, such as what you'll see in the 1997 exam. However, if you use that 1997 element exam as a reference tool as well, it will come in handy when you're looking at the 95 information. And I'll tell you why in a moment. First, let's look at the different types. You have here problem-focused, expanded problem focus, detailed, and comprehensive. I knew I wrote that one wrong. So complete comprehensive, meaning all in total. Comprehensive. And you'll notice one of the most confusing areas with this is the fact that both expanded problem focus and detailed state that up to 7 body areas systems, not body areas, up to 7 organ systems can be considered either an expanded problem focus or detailed. So how do you know the difference? Well, looking at the definitions, an expanded problem focus affects the body area or organ system and other symptomatic or related organ systems, additional systems up to 7. So the key word there is related. Meaning it's related to why they're being seen, it's related to the conditions that they're having managed. They may have multiple problems that they're dealing with today, and if it's related to that in any way, then that's all related and considered expanded problem focused. Okay? Now, remember the word symptomatic means symptoms that they're experiencing. Extended exam affects areas and other symptomatic or related organ systems. Okay, so extended exam of affected areas and other related organ systems. So the word there is extended. Now they do use the word related in both cases, but let's talk about that for a minute. There's this one rule called the 4x4. And this kind of is the basic guideline that if you have 4 elements of 4 or more body areas, then it's considered detailed as opposed to expanded problem focus. So if I count elements, 4 or more is counted as extended for that body area. And the guideline is you should have at least 4 of those in order to be detailed, even though it does say up to 7. This is very subjective, and a lot of coders don't like to use this because, as well as offices, because it's all up to the documentation and the determination of what's considered normal and what's considered extended in the exam. Now, in some of the examples I've given you, I've shown you some of those differences in the PowerPoint where I tried to point out what's normal and what's not normal so that you could kind of see that yourselves as well. But this is really something that the best way I recommend is either 2 or 4 versus 5 or 7 body areas or organ systems that are extended. That's going to be your best bet when you're talking about a detailed. Now, when you talk about elements, if you look at the 1997 elements, this really breaks up your body areas and organ systems as to what they're talking about when they talk about extended. They're meaning 4 or more of those when it's there, or multiple statements, multiple reviews in that. So for example, your constitutional only has 2 elements. If you look at the 1997 guidelines, those 2 elements include vitals and overall appearance. If the provider says a list of their vitals and says they look fine, would that be considered extended? No. But if the provider describes how they look and why that looks fine, and it seems to be more than a normal description. So for example, I've seen some doctors that will say patient looked very sickly. Their skin color was slightly opaque and their eyes were watery. Now, when they talk about eyes being watery, that could go under a different element, but keep in mind that a lot of times they may say overall appearance was sick. We did extended vitals, maybe another thing where you can put that in there. Constitutional is not really one that they're going to take a lot into, but because of that, I thought it'd be a good one to look at. Now, knowing those differences, when you look at your scorecards, you're going to determine the amount of body areas versus organ systems. There's a couple of guidelines there. If I'm talking about a body area such as the head, including face, I have to remember that the head including face in this example is not part of the musculoskeletal, but is in fact just the head including face. And so it's not going to include things that are talking about, say, range of motion or how stable the neck and the shoulders appear. This is only talking about the head and the face, more specifically the face. If I go more extended, then I'm talking about the musculoskeletal system. And that's important in identifying one or the other. You cannot identify both just because they talked about both the head and face and then went into the musculoskeletal system, unless it's clearly separate, such as lesions or something on the face that maybe you feel is different than just skin exam. So keep that in mind as you're reading through it, that you can only count one element in one area, otherwise it's called double dipping, and double dipping is not good. Double dipping is a term used commonly in the coding field that says what you used here in the note was also used here in the note, and it's the same statement. So we cannot do that. We have to separate out our 2 thoughts. Now I know some of that may be confusing, which is why you have a couple of examples that you're going to look at this week and try your hand at coding for exam and medical decision making. So we'll look at that. Now, let's take a look at the 1997 guidelines. For most new coders, the 97 guidelines are a lot easier because they're very specific in what's counted and what's allowed, and you don't have this guessing game of, was that really extended or was that pretty basic? So I like to use it as a reference Even if I'm using the 95, as I mentioned, I'll look at the elements that are in there to see exactly how detailed was it. And before we're done, I'm also going to give you another shortcut that you can use for the 95. So put that ID on the back burner. In the 1997 guidelines, and I'm just pulling up my little cheat sheet that I made here, we also have the same level of exam, which are problem-focused, expanded problem-focused, detailed, and comprehensive. Only here it's element-based and sometimes body area organ systems. Okay, so we'll look at that part in just a second. The first thing to do is to say how many elements. And the first one is 1 to 5. Expanded problem focus is 6 to 11. Detailed kind of sounds confusing if you're reading the Medicare information because it'll say 12 or more or 6 body areas or organ systems with 2 each, which if you calculate is still 12 or more. So I always just say, let's not worry about the body areas and organ systems and just know that that's always 12 or more, because either way, if it's 6 body areas with 2 elements each, or if it's 12 from 3 body areas, it's still the same number or more. But when you get to comprehensive, this one is going to be confusing. This is 9 or more body areas or organ systems with, actually, let me make my little appropriate symbol here for the term with. If you remember from previous conversations in documentation shorthand, a C with the line above it means with, 2 plus elements. Okay, so let's talk about that. By now you should have all pulled up your 1997 exam cheat sheet that was in your module 5, 1997 exam BA-system elements found under the scorecards. This is a cheat sheet that I put together based off of the scorecard for the 1997 from Novitas Solutions. If you have trouble with that, feel free to email me and I'll make sure that you have that. So you should be following along with this. So we have problem-focused, expanded problem-focused, and detailed. All don't care about which body areas or organ systems, only that you have specific elements. And when you're looking at those elements, you'll notice that some of these elements are a little unusual to what your exam may state. So it's important to compare these to the exam notes because not every doctor is the same. Not every doctor is going to document the same details or even in the same areas. They may put their exam elements, for example, orientation, person, place, and thing, or person, place, and time. You'll notice is an exam element that's found under psychiatric. However, orientation for person, place, and time is often by doctors put under the constitutional for general appearance. In general appearance, they seem orientated. This to a doctor on a clinical level may be part of the constitutional. Now that may be part of their own personal preference, part of the way that they were brought up and trained to identify this as a body system, or even part of how the operating system or the software they're using organizes it. So regardless of that, it's your job as a coder to identify what's in the exam in the documentation, where does it go according to CMS. And CMS sets the standard for the guidelines on how this works, so we have to follow that. So you'll notice there's up to, or a total of 14 body areas or organ systems. And if you look at some of these, for example, under eyes, you'll notice that not everything has a term. So a lot of times the doctor may say sclera exam. The sclera, if you remember, is the whites of the eyes. So they're saying whether or not the white looks white or if it looks maybe bloodshot. And under here, for eye exam, you have pupils and irises, which it doesn't fall under. You have conjunctiva and lids, or disc and posterior segments, which is actually only done with the tool because they have to use an eye exam tool to see the posterior segments. So where would I put the sclera? Well, the common belief is that it should go under conjunctiva and lids because you're looking at the conjunctiva, which is just the see-through clear layer of the eyes, in order to also see the sclera. So for some of them, they're a little off, and you have to really identify where it falls. What I do when I do an exam is I break up every single phrase and I say, does this have enough information to identify the body area or part? And so long as it does, I'm going to break it into one of those elements regardless of how it matches, so long as it does match in a medical and anatomical sense. So let's look at that for example. You have your elements. Okay, let's see, constitutional. And you have 2 there. Your eyes, which have 3. And I'm just doing a bunch of really bad shorthand here, so don't mind me. Again, you should be following along with the document that gives you all of this detail, so if you don't have that up, this is a great time to pull it up. I'm just giving us a little example here. Okay. So here's the big deal about these. If I'm looking at the elements, and I've only put 3 up here for your example, I'm looking at the body areas or organ systems here, and each of these elements are counted here and here. Okay? So next to each of these body areas and organ systems is a number. In my reference, if you pulled up the 2-page one from CMS or Novitas, you can use that as well. But just note that body areas and organ systems versus elements. And this is important again when we get to the body areas and organ systems for a comprehensive exam. It's very important that you can identify that because you may have 18 plus elements. Let's say that you do 18 plus elements. Now remember, this does not always equal 9 plus body areas or organ systems that count. And that's a key phrase here. If they don't count, they only count for a comprehensive exam if they have 2 or more under each. So let's say my provider documented vitals and general appearance. They mentioned the perla, but they didn't say anything else about the eyes. And then they mentioned the external appearance of the ears and tympanic membranes, which is looking at the eardrum. If I'm counting these body areas, I'm going to say how many body areas or organ systems do I have? And I'm going to count only the ones that have 2 or more elements. So here's 1. This one doesn't count. Here's 2. So I have 2 body areas and organ systems that count. Even though I have 1, 2, 3, 4, 5 elements. Okay? So it's really important to remember that the amount of elements does not equate to the amount of body areas and organ systems. You have to identify those into each area and then count them. There's a couple of tricky ones I'm going to go over with you briefly, and then we'll go to our second half, which is medical decision making and probably the biggest part of evaluation and management coding. One word of advice I can give you on that is we always take it step by step. Okay, so looking briefly at some of the tricky ones. When you have respiratory, there's very commonly documented 2. The respiratory effort is talking about how the patient's breathing. Think about that for a moment. Can you look at me and see if I'm breathing normally? Do I appear to be gasping for air? Do I appear to be having issues with my breathing, or do I seem to have good effect? In that case, a doctor can tell you that the respiratory effort is fine just by simply looking at a video. Now, however, can you do auscultation of my breathing? What is an auscultation? That's where they're listening to your lungs and identifying how it sounds, if there's any wheezing, if there's any rales, all of the details that they're hearing or observing from the stethoscope? In that case, your answer would be no, I can't do that. I can't see your breathing sounds because I'm not listening to your chest. So there's certain elements in here that a doctor may do just by observation versus having to touch the patient and physically do an exam. So with some of those, it's very important, and I'll get to, you'll understand why on that when you look at the discussion, because I want you to think about how much can the doctor look at? Can they see that you look and appear well? Can they see and observe from talking to you whether or not your orientation to person, place, and time is appropriate? How about your judgment or your mood? What else can they see about you? Can they see if your skin is blotchy? Can they see if your eyes are watery? We mentioned that one earlier. These are all different elements that can be observed and documented. When you get to cardiovascular, this is another one that throws a lot of providers and coders off because a lot of what they do when they listen to your heart falls under auscultation. So look at the different options. Is there another option for other elements that you're reading? If not, would it possibly be something that's listened to? Is this something that they're listening to and mentioning in auscultation? Another one that's commonly mislooked at, the abdominal exam. You'll notice in the 95, abdominal is listed as a body area versus GI as an organ system. I like to reference the elements that are listed in the 97 guidelines here to say what else is included in the GI that they can do upon exam. And those things here are listed as checking the liver and spleen for enlargement, checking for a hernia, an anal or rectal exam, ouch, and obtaining stool samples by the provider, not just asking the patient to provide it. So those are different elements. One other thing you should also be aware of is if it's done in an exam, it can't be billed separately. So if it's something that is an actual procedure for diagnostics, it should be clearly identified separate of the exam and billed separately. Anything that's done as a separate visit cannot be used as also part of the exam. And next week, we're going to talk about some of those separate visits, such as preventative visits, along with an office visit, and how we would separate that exam to determine a proper code. That's all I have for you today. I really want you to take some time to look at the different elements of exams. And this week, you have some charts that are provided to you that you can review and see if you can abstract. Until next time, and until we talk about our medical decision making, thanks for joining.